Hey guys, Curtis Alexander. Let's talk about the side effects that we can see with evening primrose oil. So, first of all, pretty popular supplement, particularly in women who've reached menopause, taking it to relieve some of those menopausal symptoms, and it actually appears to be pretty helpful. However, we can see some side effects with it. Overall, I would say it's tolerated well, but just some things to watch out for. First of all, we can see some skin issues dermatology wise. That can mean skin rash as well as acne has been reported with primrose oil. Next, we have GI. This probably is our most common. We can see anything from abdominal pain, distension, nausea, vomiting, diarrhea, those sorts of things. However, one thing I want to point out is that these tend to go away or at least decrease in severity the longer that somebody has been on it. There is also reports of altered taste. That's another one you can experience. But I think the biggest thing is those tend to decrease or go away after you've used it a bit. A little more serious one you want to keep an eye on, particularly if you have any sort of medications that you're taking that affect how fast your blood clots, or if you have any sort of condition along those lines, we can see platelet aggregation. That means how fast those platelets group up and stop bleeding. So what we can see is it's going to take longer for some people to see the bleeding time or their bleeding stop. So it increases bleeding time. For example, we know that people who were taking 3 grams in a study, 3 grams of evening primrose oil, they did that daily for 4 months. They saw a 40% increase in bleeding time. So very important for you to know, talk to your doctor about. Evening primrose oil is not something you should start without your doctor knowing about it if you have some sort of bleeding issue. Next, we have neurology reports as far as dizziness, maybe some headaches. And finally, there have been reports of weight gain. Again, we're kind of in this hormonal phase with menopause. So is it the primrose oil? Is it the menopause? Is it a combination of both? We don't know for sure, but just something to keep in mind. Let me know in the comments, guys. Have you taken it? Have you taken primrose oil? Was it helpful? Did you experience side effects? Also, make sure to grab your free checklist in the description. I go over other natural therapies I personally use and recommend folks. So make sure to go grab that. I will see you in the next one, guys. Thank you.